Hi everybody. I wanted to take a minute to go over the difference between EBP and research. I got these slides when I attended a conference for people who are on institutional review boards. I thought that this was done by Judy Davidson. She did a great job showing the difference between the EBP, performance improvement, and research. So I included this in this week's readings, but out of context, it might not mean too much to you. So I'm going to go just through the part of the slides that differentiate research, EBP, and performance improvement. Okay, so in these slides here, they go through actually what evidence-based practice is, and we see that it is scientific evidence, but it also includes patient preferences or values, clinical experiment and judgment, and some unique clinical situations. What we have here is the levels of evidence. So when we are deciding about whether the articles that we are reviewing about a certain topic are robust enough for us to change practice, we can look at the different levels of evidence. So this week, when you were asked to develop an EBP question, let me get my Pollitt and Beck book out. You were asked to determine what kind of question your EBP question was. So if you go to page 17 on in your Pollitt and Beck book, it starts at let's see, page 16, and it says and ask you to find the purpose behind your EBP practice question. So there are EBP practice questions that relate to treatment, therapy, or intervention. There are some that relate to diagnosis and assessment. Some can be more about prognosis, some prevention of harm, some about meaning and process. So then you were supposed to go to page 34. So you've found your EBP question, you've identified what type of question it is, and then in box 2.1, you should write that question in the template, in the form of the template that is in page 2.1. So it says for treatment and intervention in blank population, what is the effect of blank intervention on blank outcome? And so then you just fill in your population, intervention, and outcome. So that's just an example there, and we can go through a few of those. The reason why you want to know what type of question it is, because each question can be answered by different levels of evidence. So say you have a question that asks about intervention, such as giving chemotherapy. Is this chemotherapy better than this one at decreasing symptoms or prolonging life? You would really want to make sure that you would use evidence from the highest source because we're really dealing with patient outcomes here. So you'd want to make sure your question was answered robustly by meta-analysis, meta-synthesis, systematic reviews, or guidelines, or randomized control trials. So everything in the top level there, you would want to make sure you would have that evidence before you would actually change your practice. Questions that might not need so much robust evidence to answer might include something about workplace structures or systems, what kind of call bell answering system should be used in our unit, things like that. So that really this question or this intervention doesn't pose as much risk or harms to patient, so you really wouldn't you could have something like vendor opinions down there, and that could be considered a good enough level of evidence to answer your question. Down the road a little bit, you'll be asked to find some research articles to answer your evidence-based question. So be thinking about what type of research you will need to answer your question. Okay, here's a nice little table that goes over performance improvement, EBP, in research. So really you think about what is the purpose of your question or your intervention or your study. So is it to review, revise, change process to achieve improved outcomes? Then it would be performance improvement. Is it to improve practices by using the latest, most appropriate evidence? Would be EBP. And would it be to create new knowledge? That would be an example of research. And so for a lot of you this week, you gave a research question for your PICO where you were really looking at something that hadn't been answered yet. So you were trying to create new knowledge in your PICO, where you really want an EBP question for this, where some of your outcomes might be practice change, new protocols, or standards. So let's look at a few examples here. So this one is about Crystal wondering about fetal positioning at her hospital. So Crystal has read about a new fetal positioner for premature babies. There is evidence in the literature about the benefits. The device is supported by the professional NICU organization. She found it is being used across town, but not in her unit. She would like to trial the product in her unit. So this would not be research, right? Because we already have the knowledge generated and it's in the literature and it's been picked up by professional organizations. It's not being used in her hospital already, so it wouldn't be performance improvement. It is something that's used somewhere else that she wants to bring to her hospital. So then the answer is it is an evidence-based practice project. Okay, here's another one. Julie is a certified healer. She understands the benefits of meditation for stress and pain. Meditation courses are long and expensive and poorly attended. She wanted to create a short version of this meditation course and test it using PROQLO to see if it reduces compassion fatigue in nurses. This must be some kind of outcome survey. She has not found an article about meditation and CF in the literature. Is this PI, EBP, or research? So because she's creating a whole new education class and getting outcomes about it, she's creating new knowledge. So this one would be research. Okay, here's another one about urinary catheter removal. The UTI rates in the organization are high. Melissa hears other hospitals are using nurse-driven protocols for urinary catheter removal. She finds evidence in the literature this works, and there's guidelines that endorse this practice. So this wouldn't be research. We already have the knowledge. Is it being used already at her facility? No. She's bringing it to her facility. It's new, so that would be EBP. Okay, here's another one about surgical site infections during C-sections. Sarah has seen her peers and sees they are not following standards. Some have artificial nails, some don't scrub for the appropriate time, and some don't prep the abdomen properly. She wants to bring in a project that will educate to improve adherence to existing standards for surgical prep and surgical site infection prevention. So here really it seems like this facility here already has these standards in place, but they are not being met. So this would be a PI project, performance improvement. So there's already existing standards. That means we're not generating new knowledge. They are not following standards that they have in place at their facility, so that's going to be a PI project. Okay, here's one. Esther works in the PACU. There is limited end-tidal CO2 equipment. She wants to see if she can develop a method to predict patients who would benefit from end-tidal CO2 monitoring post-op. She'd like to do a review of the records, develop a new risk screening tool, and test it to see if it could decrease patients with RRT over sedation or overnight. I would say this is research because this is something new that she's doing. She's going to develop a new screening tool and then test. So this one, Patty went to NTI. Sounds like this is a conference, and she heard lots of lectures about mobility, ambulation of patients on mechanical ventilation. So it says literature review shows that early mobility can decrease delirium. So yes, this research is already out there. Her unit is not doing this, and she wants to implement a protocol to change practice. So this would be probably EBP unless this facility, healthcare facility or hospital already has a standard in place, and they're doing it on other units, but not complying with that on the unit where she works. Okay, let's look at this one, hand massage. Teresa's read articles about the benefit of hand massage for pain and stress. So read articles. This means probably there's research already out there about this. She wants to start a program in her unit where nurses routinely spend a few minutes with their patients giving them hand massage. She will look at patient satisfaction scores as her outcome measure. This would probably be EBP as well because she is bringing there's already research out there about how massage can reduce pain and stress, and then she's going to bring this to her hospital. It's not currently there. A lot of you guys have questions that are kind of similar to this one. I think the key in this one is really that it's a program that she wants to initiate based on research that's already out there. Okay, here's another one, ICU sedation. Cassia works in the ICU. In 2013, a guideline was published that recommended sedation scoring tools and minimal sedation. So the research is out there. The knowledge has been found already. But Cassia realizes her unit is using outdated tools and possibly over-sedates mechanically ventilated patients. She wants to change out the scoring tools for validated tools in the EPIC assessments, change sedation practices. So this would not be research. This would really be EBP. She's changing the process that is happening at her hospital based on research. Okay, this one. Ruth works in the ER. The Emergency Nursing Association recommends family presence at resuscitation. The physicians and nurses do not do this consistently, but there is no internal standard. She would like to create a new practice standard and put this in practice. So I'm going to have you guys reply to this in the comment box below and let me know what you think this is. Is it EBP or research? So I hope this video has helped. Please feel free to post your questions right in the text box underneath this announcement, and we can go and look at whether your question is a research question or an EBP question and help you come up with one that is EBP. All right, take care.